Good afternoon. I'm Jim Inkster, your moderator. Jeff Palermo, our news director of the Louisiana Radio Network, is producing, and the governor is at your service, Governor John Bel Edwards, for the 56th time. Almost 4 years of doing this show continuously, having not missed a month. And, of course, we're heading toward the end of 2020. We've got much to catch up with the governor about. There was an election between the last show and this one, and the COVID cases are surging. And we will have a couple of guests who are directly impacted by this in many different ways, Dr. Martha White and Dr. Bill White. But before we get to them, Governor, I know you have expressed concern over the last few days about this surge and where we're going as we hope the vaccine is in the offing. But before now and then, it looks like we've got some difficult challenges.
We do, and that's the perfect way to put it, Jim. And by the way, thank you and all the folks who make this show possible. 2 months ago, we did the 54th show on my 54th birthday. Today, we're doing the 56th show for the 56th governor of the great state of Louisiana. I don't know how many times in the future the numbers are going to match up with something, so I just wanted to,
there you go,
to mention that. No, so you're right, and a lot of people are focused on the vaccine, and look, that's great news, and it's really vaccines, plural. But we are some time before we start administering those, and we're certainly months away from when enough vaccine is administered to the population at large that we can more or less put this COVID public health emergency in our rearview mirror. Until then, we have to continue to do the things that we know work to slow the transmission. And so on our White House Coronavirus Task Force call Monday, what they call this is the bridge to the vaccine. So the bridge to the vaccine is continued reliance upon and adherence to the mitigation that we know works. It's the common sense restrictions on occupancy so that people can distance, and then it's wearing masks, it's distancing when you're with people not from your immediate household, washing your hands frequently, staying home when you're sick, and we all need to protect those who are most vulnerable to this disease. And it's really important. We're surging now across the country. Case growth is higher than it's ever been. The positivity rate is up. It's 50% in some states. I mean, that's just unheard of. We know that hospitalizations are up, the most deaths yesterday in 6 months. And quite frankly, the news here in Louisiana over the last couple of weeks has gotten very, very serious as well. For example, our positivity is up, our case growth is up. We have 200 people more net new hospitalizations than we had just a week ago. And that's a trajectory that, quite frankly, is unsustainable. And so we know we have to get back to doing what works. And unfortunately, going into the Halloween break, there were people who were obviously tired of COVID and the restrictions, looking for an excuse to not abide by them and adhere to them. They got that, unfortunately, when the House Republicans signed a petition and then misrepresented the fact that the public health emergency was over. It was not. And in fact, the public health emergency is more real today than it ever has been. So we really need people all across Louisiana, especially as we look at at Thanksgiving next week, when typically most families get together. And so you have multi-generational family members coming together in close proximity for an extended period of time. And if we do that this year, the way we've done it in previous years, there will be horrendous results. We know that. And so we're asking people to really find a way to celebrate Thanksgiving, but to do it safely, which means doing it virtually to a large degree. And anyway, it's a tough situation. And I know Dr. Martha White, who is the Region 7 medical director, she's got 9 parishes in northwest Louisiana. She has a frontline view of this pandemic and its impacts, second to none in the state, because her husband, Dr. Bill White, had a very, very serious case of COVID. And in fact, he was featured on national news to talk about him and I think it was convalescent plasma transfusion therapy that he got. But in any event, this is a very, very important show, and I want to thank you, Jim, for continuing to have this every month.
Well, it's our honor to do so, and I know listeners across the state and in other states are pleased to hear your voice at least once a month, and we will get to the two Dr. Whites on the show in just a moment. Governor, a few other matters. We hear that former Governor Edwin Edwards is in the hospital battling pneumonia. He is 93 years old. The two of you have become close. Your thoughts about where he is right now in his struggle?
Well, look, I think any time you reach the advanced age that Governor Edwards is and you are in the hospital, that is very serious. We know he was in the hospital, I think, over the weekend. He got discharged. Now he's back. He's a fighter. We all know that. And I'm not 100% sure exactly what the condition is or the prognosis or the diagnosis. But I just encourage people to pray for him in his full recovery and for the medical providers who are taking care of him as well. And certainly we wish him well, and we know that Trina and the rest of the family are doing what they can to support him and get him home.
And since we last joined you were in the courtroom, and not literally, but others representing you against the Louisiana House of Representatives, who were trying to approach this COVID crisis in a different way and limit your powers. Your thoughts about that legal entanglement?
Well, I just want the people of Louisiana to consider where we are, where the country is, indeed where the world is right now with respect to COVID, and just ask yourself, does it make sense that we would be the only state in the nation not to have a public health emergency in place? So I always thought that what they were doing was reckless and irresponsible to the degree of being unconscionable. And quite frankly, it's a pretty elementary point to realize that the House of Representatives is one body of the legislature. The legislature itself is a co-equal independent branch, but the House is not, and certainly not a simple majority of the House in terms of trying to veto or override my proclamations.
The governor, as mentioned in our first segment, has some guests with him today, both of whom are involved intricately in the fight against COVID, and one of whom, Dr. Bill White, has survived coronavirus. But Dr. Martha White is the director of the Northwest Louisiana Regional Office of Public Health. And before we get the governor to chime in, he has mentioned you a time or two. Dr. Martha White, you are with us, and tell us about where you are in this fight against COVID-19.
So, as you mentioned, I'm the medical director for public health in Region 7. We are seeing a difficult time in Region 7. We've continued to maintain a high level of people in hospitals. At one point, we were about a third of people hospitalized in the state were in Region 7. Today, I believe we have 228 people hospitalized. So, we're still seeing a high percent positivity. We're seeing people who are COVID tired and are struggling to continue to follow the mandates of wearing masks and social distancing, and therefore we're seeing an increase in our number of cases. I have great concern over that because I feel like a lot of people feel like COVID is a very mild illness, and if you're healthy, it's not going to affect you, and you'll be asymptomatic even, and do fine, and we should all just get it and move on. And I experienced just the exact opposite with my very healthy ex-Special Forces husband who almost died from COVID many times over, who fought for 8 weeks in the hospital, in the ICU, on a ventilator, with every complication that you can think of, including his heart stopping 6 times. And so I know that it is not always just a mild illness. And I really want to get that point across to people who think I can just go do what I want.
All right, Governor, would you chime in? You've gotten to meet these fine folks, and obviously they have an amazing story.
Well, they do. And first of all, Dr. White, as a regional medical director, is doing a tremendous job it is true that the Shreveport-Bossier area has never really declined like many areas of the state after the surge. They've been in a relatively high plateau, and so too many cases all along, too many hospitalizations, too many deaths. And we need to remember it's not just COVID patients who need those beds, whether they're ICU beds or surge beds. People with strokes and heart attacks and motor vehicle accidents, all sorts of people need beds. And when you're out of room, you're out of room. And we just can't afford to get there. I think because she has seen how this disease has devastated so many lives and families, including the impact it's had on her husband, she can tell you that asking people to mask and distance from others is not too much. That's just not asking too much given the very serious nature of this virus. It is more contagious by far than the flu. It is more deadly by far than the flu. And we are surging right now. What that means is we have increasing positivity. So if you roll the dice and engage in normal activity, you are more likely to pay for that, or someone in that gathering is much more likely to pay for that right now than in the past, because it's much more likely that somebody there is COVID positive and contagious. And please remember, everybody, 40 to 50% of the people with COVID are not symptomatic, but they are contagious. And we now believe more than 50% of cases are contracted from individuals, transmitted from individuals who are not symptomatic. So if you're out there saying, I'm going to wait till I feel sick before I put a mask on, understand, in all likelihood, if you do that, you're going to wait too late, and you're going to contribute to the transmission of this disease and to these numbers that we're talking about. We need to do better.
And we're going to hear from Dr. Bill White, along with his wife, Dr. Martha White, who you just heard, as we move along. But we have had some folks who are waiting patiently to talk with Governor Edwards and Drs. White. 877-217-5757. Let's go to Scott, Louisiana, and Blaze. Blaze, you're on Ask the Governor. Good afternoon to you.
Hello?
Yes, sir. You're on the air.
I just wanted to know whenever the restrictions are going to stop and our state will be open back up fully.
All right, Governor, what is the game plan? Is it a wait and see, or do you have something in mind as far as the rest of this year and what will certainly be next year?
Well, the virus is in control of that, and we're going to continue to base the decisions we make on the public health imperative, trying to strike the right balance between public health and life on the one hand and the economy and livelihoods on the other. We're going to be guided by the data. Right now, we're in phase 3, pursuant to a proclamation that remains in effect through the first week of December. I know that we're not going to be removing restrictions between now and then because cases are going the wrong way. And when you say open the state up, there are not many businesses these days that are closed. Now, we do have some restrictions, so on occupancy, for example, because quite frankly, you can't physically distance if every business is at 100% occupancy. And the things we're doing are those that have been recommended to us by the White House Coronavirus Task Force. I was on a call with them as recently as this past Monday, and talking to the Vice President and Secretary Azar, Dr. Birx, Dr. Fauci, Dr. Redfield, and all of whom are pressing the case that we need to make sure that we are promoting all of these mitigations measures that work and paying attention to the numbers, which are getting worse. And it's really called the bridge to the vaccine. So I appreciate Blaze's question, but we just aren't there yet. And I'm going to continue to do what I can to discharge the obligation that I have to the people of Louisiana, and that is to protect their public health and safety.
877-217-5757 is your Ask the Governor number. And we also want to thank the good folks led by Jerry Mayer at Hometown Productions for televising this show statewide as well. And we're glad you're listening and watching. Let's go to Stuart in Baton Rouge. Stuart, good afternoon. You're on Ask the Governor.
Governor, Dr. White and Jim, and the audience, good afternoon. Governor, since there seems to be an extraordinary concern related to business owners and employees if another shutdown is necessary, where I'm going to go out of business because I can't pay my business's bills, the employees, I can't pay my personal bills. Is there some mandate that you guys are discussing where we're just going to put everything on hold? Nobody will have to concern themselves about paying for anything until after this pandemic levels off.
Yeah, well, thank you, Stuart, for the call. First of all, I want people to focus not on going back to a stay-at-home order, shelter-at-home order, or even not even going back to phase 1 or phase 2. Right now, focus on doing what is required to slow the transmission of this disease. Wear your masks. Social distance from people not in your household. Stay home when you're sick. Wash your hands frequently. Protect the vulnerable. If we will do that, then we lessen the likelihood that we're ever going to need to go backwards. But I will have to make those decisions if necessary in order to preserve the capacity of our hospitals to deliver life-saving care. We are not there today, but we're on a trajectory where we will be there too soon if we don't do better. So I'm just asking people to do better. Secondly, I don't have the authority to alter contractual agreements that people have and when payments become due and that sort of thing. So we're going to continue to try to strike the right balance between public health and lives on the one hand and the economy and livelihoods on the other.
Governor, I recall when you were on this program in March when the first stay-at-home order was imposed, you indicated this would quite possibly be an 18-month crisis, and that seems to be a realistic projection at this point. But the next step, many of these same people who were averse to wearing masks and taking precautions are also now denouncing vaccines. Do you think that's going to be a battle if and when we have a vaccine ready?
Well, I guess if you're anti-science, you're anti-science. And if you're going to claim that the virus itself is a hoax, then you may also not appreciate the science that leads to the vaccines. But I will tell you, vaccines, once the FDA issues an emergency use authorization, I have been briefed on this regularly from the White House, and I believe that all of the steps to ensure the safety and efficacy have been in place. They have been performed. And so I do encourage people to get the vaccine once it comes out and it's available to them. You've got to be patient because it's not going to be available in the number of doses we need for everyone. So we're going to focus on healthcare workers, and we're going to focus on elderly people and congregant living, where there's nursing homes, assisted living centers, and that sort of thing at first. And then we have a strategy that's been worked out with the federal government where over time, as more doses become available, they will become available to the general public. And we hope and expect that individuals will be able to get their vaccines. And remember, it's at least for Moderna and Pfizer, it's going to be 2 shots, one 21 days apart and one 28 days apart. But just like you get the flu vaccine today, you can get it at your hospital, at your doctor's office, at a health clinic, at a pharmacy, that sort of thing. And so that's what we're working towards. I'm optimistic that we may be receiving allotments, again, in limited number, but before the end of the year. And we have a very detailed plan to get those out. Logistically, this is going to be very, very difficult for the reasons that I just told you, but also because of the ultra-cold storage requirement of the Pfizer vaccine that I believe it's minus 80 degrees that it has to be stored at.
Before we go to the break, let's hear from Dawn in Lake Charles, who's been waiting. Dawn, you're on Ask the Governor with Governor John Bel Edwards.
Yes, hi. I got a call from the Calcasieu Parish School Board, and they're reinitiating full capacity face-to-face school on November 30th, and I'm really wondering if it's safe to do that yet.
Yeah, well, Dawn, thank you very much for the call, and they have a plan that's been promulgated by Bessie that directs local school districts to look at different things in terms of what type of education they offer, whether it's virtual, whether it's in person, or some combination of both. And quite frankly, until you just said that, I wasn't sure what they were doing in Calcasieu Parish. But I would hope that you have the option as a parent of keeping your children in virtual education if that is something that you choose to do. And because, I mean, we want parents to have the best possible information and the most choices that they can reasonably have around this to ensure the safety of their children and the safety of their family. Now, we have had pretty good results thus far in K through 12 schools. Not to say there haven't been outbreaks in cases, but our school systems have been very responsible up to now.
Please be patient. If you receive a busy signal, the number is 877-217-5757. We'll try to hear from as many of you as we can in the second half of the hour. Dr. Martha White and Dr. Bill White are special guests joining us from North Louisiana. Dr. Martha White is the director of the Northwest Louisiana Regional Office of Public Health. Her husband, Dr. Bill White, is a COVID survivor, and when I say survivor, he was on a ventilator for about 2 months. And we'd like to hear from Dr. Bill White, but as I mentioned, Governor Edwards has become quite acquainted with these people, and throughout your tour of the state as governor, as you do travel from one end to the other, and you've done so during hurricanes, but pandemics as well. And in this case, you get to meet people like this, and there are some heroic stories amid this COVID tragedy, and the White story is one of those, Governor.
No doubt. And look, I am always just amazed and inspired by the people of Louisiana. We have so many really good, decent, hardworking, generous, faithful people, and a lot of those people are public servants. And if the state could see what I see every day, and that's how hard folks are working, whether it's National Guard, state police, fire marshal's office, and yes, the people at the Department of Health, especially in public health. You know, this is our generation's crisis. It happens to be a public health emergency, a pandemic, not something that is easy to deal with. But we have some tremendous public servants, and Dr. Martha White is one of those people, and that's why I was so proud to have her working for the state and leading those 9 parishes. And I will tell you, she has a perspective on this that is probably better than just about anybody else in the state of Louisiana.
And Dr. Martha White, we heard from a moment ago, but as mentioned, Dr. Bill White is a COVID survivor, and I think he is with his wife. Dr. Bill White, are you there?
Yes, I am, sir.
And how long ago was it that you contracted COVID?
Well, I was admitted March 28th. I was exposed at a gas station. I did all the things you're supposed to do. Unfortunately, getting gas, my mask fell off in the water, and 30 seconds later, a woman coughed right in my face 3 inches away.
Oh, my.
And that was the beginning of my new chapter in my life. So I was, and, you know, talking about COVID and why should people wear masks, I was an individual exposed. At no time did I have a fever. At no time, I had mild malaise, but at no time did I have all the things that you hear. I didn't have any of that. Matter of fact, I didn't spike a fever until day 3 in the ICU on a ventilator. So, you know, you just don't know. And by the time a lot of people know they're exposed and that they weren't protecting themselves, they spread it to other people. So that's how my story began. And so from March 28th, when I woke up, it was May 7th. And I had long hair and a beard and nails that were about an inch long. And I realized I was out longer than a couple days. And, you know, and I always say, you know, it was a struggle for me physically, but of course I wasn't aware, but it was hard on my wife, my children, my faithful patients, friends, acquaintances, and my being the doctor in Louisiana to get it really shook the medical community here. Some of them had different varying opinions, but then when they knew somebody who was very healthy and running and exercising and doing what I did, it gave them a different perspective.
May I ask how old you are?
57.
57. So by today's standards, you're a young man, healthy man, active person, and a doctor.
Yes,
and we're doing all the right things and still had a close call. How has this affected you emotionally?
Well, I just I've done a lot of things in my life that have been tough, and everything is, either you have faith in God and you have a strong family unit and you have friends that stand by you, or you become careless and throw things into the wind, and that's not me. I believe in, freedom comes with the citizenship, and being a citizen in the United States, it comes with responsibilities to yourself as well as others. And, that's why I like to help people as a physician, but I think you need to lead by example.
And Governor, I am sure you are inspired by the story, which explains why you invited these fine people to be on the show today.
Yeah, absolutely. Again, the combination of this married couple, both doctors, and it just offers us an insight into this disease and into how it affects individuals and families, but also the community at large. And so I thought that they would be the perfect guest to really talk about this, especially as we wrap up this week and get ready for Thanksgiving week. And quite frankly, Thanksgiving and Christmas this year shouldn't look like previous years. If they do, around the households of Louisiana, far too many people are going to get sick. Far too many people are going to go to the hospital. And yes, too many additional people are going to die. We need to find new ways to celebrate and try to be close to family virtually and so forth, but without being close physically and causing individuals to get sick.
We have Governor John Bel Edwards with us for the 56th show for the 56th governor, and Doctors Martha and Bill White are also at your service as we move along. Let's go back to phone calls across the state. This from Slidell. Rick, good afternoon. You are on Ask the Governor. Hi, Rick.
Hi, Governor, thank you for your great work in this epidemic. I think you've held it together very well, and we're proud to have you. My question is, how far are we away from getting new case COVID data in real time? And I guess the other question would be, how close are we to being able to target zip codes?
First of all, Rick, thank you very much for the call and the question. I would assume that you know that we have a public-facing dashboard that we update every day except for Saturday with test information. And it is an extremely transparent dashboard that really represents a best practice across the country. You can go to ldh.la.gov and look at it. Now, real time is hard because for a lot of reasons, but one is we assign a positive case and a test back to the date that the test was conducted. So even if we let's say we get 20,000 cases, 20,000 test results in today, those all get assigned back in time to whatever day they were actually taken, and almost all of those, 98, 99% routinely, are within the past several days. But real time is really hard for that reason. It's also hard because we've introduced a large number and a growing number of antigen tests. These are point-of-care tests that don't go to a laboratory. And so quite often we won't get all of the negative results. We do get the positive results, and that's why we report them separately, so that you know that the positivity rates that we're talking about are PCR tests. Those are the tests that we've been doing all along. And then we will add antigen test positives in, but they don't influence the positivity number. So we're doing the best that we can. And I think Dr. White, Dr. Martha White, may be able to talk more about testing and the transparency, because she routinely relates all of this information to healthcare providers and to public officials in those 9 parishes around northwest Louisiana. So, Martha, I don't know if you had anything you wanted to add.
You know, Governor, I think we've been more transparent in public health and Department of Health with this pandemic than we have ever been. We have good numbers that are up there. Our percent positivity is shown, weekly, and we get daily test counts, even probable positives. So I think we really do have a good database for people to take a look, and it is down to census tracts. So you can, if you look at the map itself on that website, at the bottom of it, you'll see 2 little arrows, and you press those arrows, it'll take you. You can look at your own parish. You can look at census tracts in that in your parish. You can look at everything from race, division along race lines, along male-female, age groups, and it really does give you a lot of good information.
Governor John Bel Edwards with us, along with Doctors Bill and Martha White. And let's go to Stacy in Lafayette, who has been waiting for some time. And Stacy, you are on the air. Thanks for your patience. Good afternoon to you. Hi, Stacy.
Governor, for taking my call. I'm in Lafayette, and I'm sure you know that the situation here is pretty bad, as it is in other areas of the state. Our hospitalizations have increased from 50 to 120 in a month, and it's really crazy how the bars have just all gone back to normal. I'm sure you know about all of that. There's so much video and photographs that have been going around. Our mayor does not take this seriously. You rarely can see him in a mask, along with the other mayors from around our parish. So I guess my question is, because they have said that the reason they aren't enforcing it is because it's a state law. But as the wife of a former police officer, I know that he has arrested people, issued citations to people on state laws. So I'm just trying to get some clarity on that and find out how your office can be of assistance.
All right. Thank you, Stacy. Governor?
Stacy, first of all, thank you very much for the call, and I appreciate your concern. First of all, we are doing courtesy visits, compliance checks, and so forth to restaurants, to bars, to other venues, to try to make sure that people understand what the restrictions are and what their obligations are if they're going to open their doors to the public. We do invite as much assistance as we can get with that, and when we have businesses that fail to make the necessary corrections, if we find them deficient, then we will take an enforcement action. Unfortunately, we do have a lot of folks out there who don't take this as seriously as they should. And I've said from the very beginning, with 4.65 million people, tens of thousands of businesses, we're going to do the best we can to promulgate very clear restrictions and so forth. We're asking people to comply with those, but we're not going to be able to enforce our way out of it. Through this, I should say. We really need the people of Louisiana being responsible as much as possible. And that includes all of our leaders, business leaders, faith leaders, nonprofit leaders, and yes, elected officials too. And so I do ask for all of these individuals to help us to gain more compliance with these mitigation measures and restrictions. We know that they work, and we can't simply say, well, we're not going to try to slow the transmission of the disease. We're going to increase the capacity of our hospitals. Well, that's just asking for more people to die than is necessary. And quite frankly, it's not that easy. We can put beds anywhere. Well, where are you going to get the doctors and the nurses and the respiratory therapists and so forth necessary to render the life-saving care? Because this is a nationwide surge. Nobody's given up their doctors and nurses right now to go to other states. So we need to all get in this and understand this is just the challenge for us right now, and it's going to be really tough for the next couple of 3 months. And then, with any luck, we're going to come out on the other side, having flattened the curve, and while we're introducing vaccinations to more and more of the public. But right now, we need everybody on board. Everybody in the state of Louisiana has a role to play. Elected officials have a bigger role to play than others.
Governor, since we last talked, we had an election on November 3rd, 16 days ago, and Joe Biden won the election, and Cedric Richmond, congressman from New Orleans, is going to the West Wing to work for President Biden when he takes the oath of office. Your thoughts about the outcome?
Well, first of all, it's a good thing for the state of Louisiana to have Cedric Richmond in such a senior position of influence at the White House, especially as we continue to try to recover from multiple hurricanes, 3 of them. I think we had a hurricane since the last time I was on your program, too. Yeah, we had three that actually made landfall in Louisiana this year, including the strongest storm to ever make landfall in Louisiana, or at least since 1856, and that was Hurricane Laura. But to have him in the White House is going to be helpful to the state. I know that he will advocate for things that are important to our state. I had a good working relationship with Vice President Biden in his last year of the Obama administration. I've enjoyed the working relationship I've had with the current White House, with the President and the Vice President. And I'm looking forward to resuming that working relationship with President Biden and Vice President Kamala Harris. And I know they're President and Vice President-elect at the moment. But it certainly seems that they did win the election. That's where we're headed, and I do hope that there will come a time soon when they can begin an orderly and meaningful transition, because this transition is occurring when we have a public health emergency, the likes of which our country hasn't experienced in more than 100 years. And for other reasons as well. Transitions are always important, but it's doubly important this year. And so hopefully we'll get to the point very soon where that can happen. And I look forward to visiting with Mr. Biden soon to talk about our recovery needs as it relates to the hurricane.
Obviously, some members of Congress who are representing us, the people of Louisiana on Capitol Hill, are reluctant to acknowledge that the president lost the race. It appears to be fairly substantial as far as the margin of victory. Your thoughts about why the race is being contested when, in the overall scheme, it is not a particularly close race, Governor?
Well, I think it's 306 electoral votes for Joe Biden, which coincidentally is the same number won by President Trump 4 years ago. And I think it's more than 6.5 million popular votes that Biden leads by. So it seems that way to me. And look, I'll be the very first to say that if there is evidence of widespread voter fraud that would undermine the integrity of election and call into question the outcome, then the president has every right to pursue that. But thus far, we've heard a lot of talk. We haven't seen much evidence at all. I don't know of a single meaningful case that has been prosecuted in any court in the country, and so hopefully the president is getting to the point where he's going to be able to congratulate the winner, effect an orderly transition, and that is in the best interest of the country.
James in Longview, Texas. James, we're glad we got you in, and glad you're calling again from the Lone Star State. You're on with the governor. Hi, James. Do we have James, Jeff? Okay, let's see if we can pull him up. Obviously, James is not there, but we hope we can get him before we leave. Dr. White, Martha White, a question from a listener directed to you is that how have you avoided getting COVID-19? Your husband had it. Obviously, you're on the front lines of this. You're in the danger zone, but I understand you have been spared. How have you done it?
So as soon as my husband came home on the Monday, he first fell ill. He social distance from us. He stayed in our master bedroom. If he needed anything, we wore masks, and we really kept our distance. We did what we are telling people to do out in the public every day, and it worked. You know, we if he needed a bottle of water, he texted me, and I dropped it off.
All right. Ellen in Lafayette. Thank you, Dr. White. Ellen, you're on Ask the Governor with Governor John Bel Edwards. Hi, Ellen.
Hi, thanks for taking my call. I had a quick question about CARES Act monies and using them for universities to increase class offerings by hiring more instructors or paying professors more to teach additional classes so that class sizes can be decreased and more in-person classes can be offered.
All right. Thank you, Ellen. Governor?
Well, Ellen, first of all, thank you very much for the question. I will tell you that a considerable amount, and I apologize, the figure is not on my mind at the moment, and I can't recall it, but a considerable amount of funding was made available for education, both K through 12, and for higher ed in the state of Louisiana and elsewhere throughout the country in the CARES Act, and that money has gone to the institutions, and they had some flexibility as to how they used them, and I don't know whether that happened in Lafayette or elsewhere like you were just mentioning. I can tell you that with the discretionary GEARS funding that I got as governor, it was about $50 million worth. A significant chunk of that went to higher ed and went to training professors on online instruction so they would know how to present online instruction, and that was something we coordinated through the Board of Regents and Commissioner Kim Hunter-Reid. And I'm hopeful that there will be another stimulus, and if there is, I think it's agreed to by both parties and so forth in Congress, that there will be additional funding for education, and so hopefully that'll happen in the not too distant future.
All right. James in Longview, you're on the air.
Hi, Jim. Hi, Governor Edwards. Anyhow, it's show 56, Governor 56, and I'm 56. I'll get right to it. Governor, do you expect more communication between you and President-elect Biden?
Yeah, well, perhaps. I think the communication with the White House will be improved, not necessarily because of the President Biden, but because Cedric Richmond is going to be there. He's a longtime personal friend. He's from New Orleans. He's a congressman today. And so that's going to be very, very helpful.
Thanks for listening to Ask the Governor with Governor John Bel Edwards. This program is produced by the Louisiana Radio Network.